Well, abortion clinics across the state were forced to close this week after Indiana's new abortion ban took effect. But pregnancy crisis centers are still open for business. Tonight, Rachel Kraus uncovers concerns among doctors and lawmakers about the services these centers provide.
With abortion now banned in nearly all cases in Indiana, pregnant women in need of help or health care will now have far fewer places to turn. Crisis pregnancy centers are everywhere, all around the Hoosier state, but they can't offer abortions or even health care.
What we consider to be crisis pregnancy centers, or these centers that focus on anti abortion education, are very problematic. Many times there is not anyone with actual healthcare training on site, much less on staff. Many times these locations exist for the sole purpose of coercing patients to continue a pregnancy.
These crisis pregnancy centers can't offer women prenatal care or contraception, often just advice from non-medical professionals seeking to steer women away from an abortion, often using confusion or fear tactics to continue a pregnancy. Dr. Katie McHugh, an abortion and OBGYN care provider, says that's concerning and problematic for women. As a doctor, she says you present your patient with all the medical information and options and let them make the decision. To withhold critical information from patients, she says, would be unethical.
In fact, we have laws now that protect patients' information and the access to their own information. What's tricky is that these crisis pregnancy centers get away with it because they're not actual healthcare centers. So then they don't end up being beholden to those same laws.
But still, internet searches for abortion can quickly steer you toward these centers, and often they get state funding to do so. Now that Indiana has banned most abortions, Senator Shelley Yoder says she's concerned that state funding will be increased even further for these centers, further confusing pregnant people on their options.
We are continuing to fund these centers and funnel more and more dollars to centers that, quite frankly, do not have truth in advertising, do not provide the kind of care that their billboards purport to provide.
Yoder says she wants to see the state tamp down on funding and false claims made by crisis pregnancy centers, trying to turn women away from abortion care. Amendments to do that failed in a special session, but Yoder says she'll be bringing legislation back up this next year, pushing to ensure these centers are required to be truthful in advertising and in services, so Hoosier women can make the best decision for themselves.
We need to make sure that we're holding crisis pregnancy resource centers accountable and that Hoosiers have the information that they deserve in order to make sound decisions for themselves and for their health care.
So we reached out to multiple pregnancy crisis centers for comment. So far, none have gotten back to us.